Bangladesh, a country with vast coastal areas, is already witnessing the severe impacts of climate change. Scientific evidence confirms that rising sea levels and increasing salinity are set to intensify. Women in those coastal regions such as Shamnagar in Satkhira, Mongla in Bagherhat, Pathorghata in Borgona, and Potoakhali, where poverty and climate change collide, women face a harsh reality. No access to pads, clean water, or proper menstrual care, which is resulting into serious reproductive health issues. Also, period poverty forces them to take oral contraceptive pills to stop menstruation, risking their health and violating their sexual and reproductive health and rights. The ultimate solution of this problem can be Project Cup of Dignity, where menstrual cups are provided with installment plans to the women of our coastal regions. These cups are eco-friendly, sustainable, and reusable. Also, this cut up their cost of menstrual products up to 97%. These cups require minimal water for cleaning, which makes them perfect for places where there is lack of water, and also they provide protection for 12 hours, which ensures women's health and hygiene without compromising their dignity. This project will have two phases, the pilot phase and the broad implementation phase. On the light of the pilot phase. On the pilot phase, we will concentrate on distributing the menstrual cups on installment in coastal regions of Shamnagar, which is in Satkhira. The broad implementation phase will concentrate on distributing menstrual cups on other coastal regions of our country, which are Borgona, Bhola, Cox's Bazar, Potoakhali, and Khulna. The National Menstrual Hygiene Management Committee can adopt and implement the project. This committee holds the key to transform menstrual health in Bangladesh by uniting different ministries, government agencies, NGOs, and private sector partners for coordinated action. The Ministry of Health and Family Welfare, as a key stakeholder in the National MHM Committee, will ensure advocacy and manpower through DGHS and DGAP. DGHS will engage community clinic and their workers and Upazila Health Complex, while DGAP will involve Union Health and Family Welfare Center workers. In this 6 months pilot, FDA-approved menstrual cups imported by Menstrual Cup by Mumble, led by menstrual hygiene worker Nahid Deepa, will be distributed. In the later phase, for the first time in Bangladesh, menstrual cups will be locally manufactured using medical-graded silicone, making them more cost-effective. EDCL, DGDA, and the Ministries of Finance, Industry, and Commerce must coordinate to streamline the import, production, and distribution of menstrual cups and raw materials, ensuring affordability and quality. JMI Syringes and Medical Devices Limited, with its expertise in medical-grade materials, can be considered for collaboration for local production. Now comes the involvement of key organizations that can support this project through financial contributions, fundraising, campaign programs, and effective implementation such as UNICEF, UNFPA, WHO, Water Aid Bangladesh, Action Aid Bangladesh, BRAC, SNV, Netherlands Development Organization, Sharna Kishori Foundation, etc. Promoting menstrual cups in the coastal regions of our country is no small task. There comes challenges such as lack of awareness, deep-rooted misconception, social stigma, and financial barriers. Firstly, awareness at the grassroots. Community health workers are the backbone of change. They can organize awareness campaigns in schools and localities, directly addressing women and girls. Door-to-door visits create personal connection and trust. Engaging religious and community leaders. Religious and community leaders hold significant influence in our conservative societies. Collaborating with these leaders and convincing them to have menstrual hygiene discussion during Talim sessions and society gatherings, they can normalize menstrual cups in a culturally respectful manner. They can emphasize cleanliness and taking care of health as an integral part of Islamic faith. Thirdly, mobilizing female doctors. Female doctors from Upazila health complexes are pillars of trust. Collaborating with health workers, they can systematically campaign across unions, dispelling myths about menstrual cups. Free medical checkups can draw women to these sessions, reinforcing credibility and breaking misconceptions about virginity, cleanliness, and safety. NGOs as catalyst. NGOs like Ritu can raise awareness through creative tools like comic books on menstrual hygiene and menstrual cups. Organizations such as WaterAid Bangladesh, Save the Children, ActionAid, SNB, Netherlands Development Organizations and SPRAC can expand their existing menstrual hygiene programs to include menstrual cup education, amplifying their impact. Leveraging social media. Targeted campaigns on social media can highlight the cost-effectiveness of menstrual cups. Also, Facebook groups and WhatsApp groups offer safe space for women to share experiences and find support. Lastly, overcoming the clean water barrier. Initiatives like Logic and UNDP's GCA project promote rainwater harvesting and filtration, while NGOs like CCEC empower communities with sustainable solutions. By following these strategies, menstrual cups can become the symbol of dignity, health, and hygiene for women in coastal regions of our country Bangladesh, just the way they improved the menstrual health management in countries like Nepal, Bhutan, South Africa, and Kenya. The Cup of Dignity project is feasible in Bangladesh due to the existing infrastructure of the Ministry of Health and Family Welfare, the National MHM Committee led by the Ministry of Local Government, Rural Development and Cooperatives, and the growing medical equipment industry. Advocacy is crucial to integrate menstrual health into national health policies, ensuring long-term solutions to period poverty. This will secure continuous product supply, enhance local manufacturing and distribution, and create demand through awareness campaign. Why the project Cup of Dignity matters? Because if it's successful, it combats firstly gender-based violence, because it refers to harm inflicted due to societal norms or power imbalance, often targeting women. In saline regions, poor menstrual hygiene management fuels GBV through stigma, isolation, and coerced medical interventions like early hysterectomies and forced contraceptive use, violating women's rights and autonomy. This project improves MHM, reduces health risks, dismantles stigma, and breaks cycle of reproductive coercion, ensuring women's right to health, choice, and freedom from GBV. Secondly, it's a sustainable choice by reducing waste from disposable pads, tackling pollution, and offering a durable, reusable solution. Thirdly, this project can be expanded to flood-prone regions like Litfamari, Jamalpur, Netrokona, Sunamganj, and Kurigram, supporting women during floods. It can integrate seamlessly with existing infrastructure, ensuring access and resilience for women in crisis. At last, altogether, this project addresses SDG 3 Good Health, SDG 5 Gender Equality by empowering women with safe menstrual hygiene. Its zero waste feature supports SDG 12 and SDG 13, which are responsible consumption and climate action, making menstrual cups a sustainable solution to climate change-driven period poverty. I am Sharma Sweetie, the team lead and sole member of Team Arcane, the driving force behind Cup of Dignity. This project is just not a mission, it's a commitment to empower women with equality. By breaking menstrual taboos and providing safe, sustainable hygiene products, we are helping the women of coastal regions of our country to achieve good health. Together, we can break all the barriers and make a world where no woman is held back by period poverty.